Welcome to Nursing School Explained and this third video about how to prioritize NCLEX and exam questions based on the ABC method. So airway, breathing, and circulation should always be your three #1 priorities. If you determine on a question that there is no problem with the airway or the patient's breathing, so we have checked that off the list, then we move on to circulation. That's always our #3, our third priority. And terms that you might see on the exam question that hint towards some problem with the patient's circulation are muffled heart sounds, such as in a pericardial effusion, any abnormal blood pressure or heart rate. And particularly think about if the patient's blood pressure is low with an elevated heart rate, most likely they are dehydrated, and that certainly can have bad effects on the patient's health and their overall status. Now, other things to consider are absent or diminished pulses, because not only should we think about the central circulation and a problem with the heart, but also with the peripheral circulation, where there could be a broken extremity, for example, some sort of an injury, and all of a sudden the blood flow to that extremity has been diminished or is gone. So the pulses would hint us towards that. And then certainly any kind of skin changes. So that would be that the patient's skin is pale, cool, diaphoretic, shifting the circulation away from the not important organ, the skin in this case, to the internal organs. That also tells us that there's a problem with the patient's circulation. And then, of course, any EKG changes, any new rhythm, any new complaints of chest pain, shortness of breath could certainly be a circulatory problem that we need to address. So hopefully these terms will help you narrow it down a little bit. Remember to always start with airway, breathing, and then if you don't find a problem there in the question given, then move on to circulation to determine what is going on with the patient and answer the question correctly in terms of the priority needs of this particular patient. Please check out the other videos where I go into terms for airway and breathing, and I'll see you soon right here on Nursing School Explained. Thanks for watching.